Just check
So yeah,
do you feel we are going to start. We're past 9 o'clock. It's okay. Just get your teas and coffees and stuff. But so welcome everyone. For me, it's been many. Michelle said, "Don't say this," but it's been many years since I've been at a Health and Wellbeing Board. And so bear with me. I will go through the agenda as quickly and as efficiently as I can, making sure that we deal with all the business that we have to do. So have we got any apologies, Marie?
Yes, June Davison sent her apologies, and Deborah Price. Robert Mitchell sent his apologies. Karen Jones was going to substitute, maybe she's running a little late. Emmerich sent her apologies. Joe Smythe is here on her behalf. And to let you know that for the Safeguarding Children's Board report, Debbie Key will be presenting as their chair is unavailable today.
Thanks for that, Marie. The minutes, it's page 5 to 8 in our paper. We need to confirm it's true I wasn't here. Anyone want any comments on the minutes? Any actions coming from them? Sorry? Any actions?
Okay. The actions will be followed up from an email. He sent an email on to board members off.
Okay.
On those.
Okay. So we're happy to accept those minutes?
Yes. Yes.
Thank you. Declarations of interest. Any declarations of interest? All right.
Just the fact that I am a PA, personal assistant, so I just give that as a.
Just declare, that's fine. I think I will declare that I am part of a care provider service on the Isle of Wight that is contracted to the Isle of Wight Council. If there are any items that come up on the agenda, I will refrain from commenting or voting on them. Thank you. Public questions, lines. So we have just one written question. I'll read this out. Would you? But Julian's not here. I take it. I'll read it out and then we'll issue a written response publicly after. So I'll just read it out. You okay with that? Okay. So does the Health and Wellbeing Board recognise the increasing levels of vulnerable children and young people on the island, not in education or in reduced education scenarios, and the increasing risks that some of them are facing in terms of either being a victim or a perpetrator of crime or antisocial behaviour or exploitation? Does the health, this seems like two, does the Health and Wellbeing Board agree there is need for further joined up actions across the system to address these challenges? We'll issue a written response to that and issue it publicly as well. Thank you. Any other questions? I'm aware of a question from Councillor Lilly.
That comes under members' question time.
Okay.
Although he did ask it during a specific item, which I think is the first.
We'll cover it during that item.
So we.
Okay. There's a written question from a councillor, a member. I'm happy to do it as a member's question. He's not here. We'll provide a written response, which probably allow you to go through your 1001 days without disruption. So
Something about how do we kind of have a collaborative approach to some of these things? Because yes, absolutely, the council questions are helpful, and we do that together. Because sometimes it feels like, you know, we're a partnership board, we're a slightly different council committee than others, and you know how we work with the rest of members to help them understand that would be welcome.
fair enough. Thanks.
Yeah, just to, if I can pass comment, just to add to the question from Mr. Wadsworth there, just to say that, you know, full support in terms of the OPCC and policing to understand and recognise the concerns that are in that letter in terms of the number of elected home educated children the difficulties, I guess, in terms of being able to grip them and get into those families where they don't have that education network there. And from a commissioning perspective, from our perspective, in terms of the commissioning that we provide, we recognise the time that it takes, the additional time it takes when you haven't got those supported networks around the work that Mr. Wadsworth does with those young people and the challenges that he's got there. The service it's taking, you know, 3 or 4 times the amount of time that it would take, you know, for it to work with a child that's off record than to one that is in an educational setting and have those networks around it. So in terms of the scale of the problem, probably the links to criminality as well, we absolutely support, you know, the comments made there and express the concerns.
Something we've discussed before.
But it's not something we've discussed before, but is there something about home educated children that are actually having a really good education at home to those children that have been excluded and are now being educated at home? I don't know if we've can't assume that all
Yeah.
home educated
No,
children
no, of course, and that's
are not getting good education and are being led into criminality. So I'm slightly, you know, I think that needs to be discussed a bit further. I don't think we can make those assumptions.
I think the response sets out kind of the partnership boards that's dealing with that. So there's kind of education committees and lots of people are onto that. So I think maybe if we just make sure that that's circulated to all members, but I think it does answer the question in your way, Michelle.
Yeah.
It's an important thing to consider, but it's not all about.
of course, yeah, I agree, and not to make any assumptions around those numbers. I guess it's highlighting that the disproportionate amount on the island, I mean, some 3% compared to mainland. I mean, Hampshire, for instance, has 0.4% of elected home educated children. The island has a hugely disproportionate amount, and that is, I think, probably a concern in terms of gripping and tracking, and with concerns around county lines and things like that. It just changes the framework.
I appreciate that.
Well, I would suggest, because there has been some informal meeting that we've done, and maybe we should invite Julian in actually to have a discussion around it, to understand it in a bit more detail. I've actually done that with him, so I understand it quite well, but I think it might be worth doing.
Karen.
Yeah, let's look at the responses. I think education are onto it. I think there is something you're right about. The level of home education here is higher, but that might be because people are choosing to move here to home educate. So it's quite a complicated picture. So I can pick it up with the education outside and work out the best place for that to be discussed.
Thanks, that's fine. But what I'd like to suggest is that we do pick this up at a future meeting. It does sound as though there's some interesting debate to be had on this, and let's agendarize it for a future meeting. Thanks for your comments, they're really helpful. But just one other thing I asked, maybe you may or may not find this any pertinent, but we've got reply to time, which is really helpful to the questioner, but you haven't seen the reply. And I just wondered whether you
have a look at it.
whether you needed to see these replies and their
So
sense.
I mean, how do we make it a partnership rather than it's the board's been asked the question? And it wasn't my reply, it's education's reply, because it's an education thing. We have mechanisms of Councillor Andrew know from her previous portfolio. We're looking at home education and it's a big structure around supporting those people, as Terry said. So I think let's talk to education colleagues and work out the best place for them. And then if we think that's really impacting on health and well-being, which is what we're about, we can bring it back here. So let's remember what our purpose is here.
But that's something about the reply, isn't it?
Yeah.
So is there something about we discuss the question here and then we formulate the reply afterwards, after our feedback and our, you know, for example, concerns you've raised about 3% to 0.3% on the mainland and stuff. I don't know.
Let me pick that up with education and I'll
Yeah.
brief. We talk to, I think it's Natalie, isn't it, who's done that?
I mean, and Terry, sorry. Terry will know this, but I was actually told that when a certain more children were being educated in Portsmouth, then you had a strategy around that kick in.
Yeah, so I'm not sure whether the island have worked with PCC, with Portsmouth, in terms of sharing strategies and looking at that. I mean, that's
That might
probably
be
a
worth,
conversation for children's services and what have you, but they had a good grip of the rise that they had there. So there is a strategy in place.
looking at.
You know that, Debbie. I'll come to you. Do you know that, Debbie, whether we've been discussing with Portsmouth that on children's?
Only through the community action with Julian Wadsworth. I think that's the only connection that we've had through the PCC. And it was more about actually getting funding through.
So, no, it's not been looked at.
Emma,
It was just really to try and cycle the topic back to the original question of Julian's, which is about children absent from education. So let's just park the reasons why they might not be in mainstream education. His concern was really about the vulnerability of children where we don't necessarily know where they are during the day and what they're getting up to. So, and those children are at risk regardless of.
I think we should read the reply. So in terms of,
Simon, the problem is nobody's seen the reply. That
We
was
could
the
read
point
it.
It's making.
should we read it out?
Well, it's a place. I'm happy to do it. I was just asked as a matter of principle. We've sent a reply as the board, and the board members haven't seen it. That's all I'm saying is, do you want to see it or not? That's all. It's a simple question, really.
Let's hear it, shall we?
If you
I
don't,
think
if
it
you're
would
all
make-
happy.
With the question out, I think it would make sense to read the reply out because it may answer some questions
Okay.
that we're.
Do you want to do it? Shall I?
I recognise that Stuart's not, it'd be Stuart Ashley, but I can read on. Do you want me to do it? Phil, would that be helpful? In terms of children missing in education, an increase in the number of referrals in 22-23 due to improved practices around identifying children who are not accessing education and stronger communication with schools and other local authorities. Due to this, the number of children not located remained low, 7 children in 22-23. The number of students in the Isle of Wight being educated is high in comparison to other local authorities. DfE only started collecting the data in this academic year. At the end of the academic year, 22-23, there were 619 educated at-home pupils, which represented 3.8% of the population of the schools, children aged 5 to 16, including 124 year 11 pupils who left statutory education. The Isle of Wight remains renowned for having a thriving education at home community for many parents. This represents a positive parenthood rather than a choice that increased risks for the young people. Further to an invite from the DfE, team attended a seminar for those with high rates of EHE in June 2023. Data shared including high levels of home education, but also high levels of communication with families. Additionally, the level of communication with the community is recognised to be of a high standard, recognised by 3 different awards. There is not sufficient evidence to support that children who are electively home educated are more likely to be at risk. As of October 23, 22 of the 526 students are identified being open to child protection need or early help plan. This is in line with those who are not electively home educated. For those students on the roll of schools, the local authority works with schools support students not receiving full-time provision with the aim of increasing their time in school where possible. All schools have reported students to be in receipt of reduced hours provision or accessing provision elsewhere and have confirmed they have either completed a risk assessment for children open to child protection or children in need, confirmed that the child is not on such a plan. Schools have also confirmed they have consulted with relevant authorities, including social care, the virtual school, SEN for EHCP children, to discuss reduced hours provision. Figure for young people post 16 who are not accessing any form of employment on the Isle of Wight is 3.1%. This compares very favourably to the national position of 3.7%. Education, Island Futures and Youth Justice System work closely together to identify any children at risk from the above, provide support, particularly with careers advice. Moving on to the increasing risks. The Youth Justice Services have information to support that some young people are more at risk of being a perpetrator of crime or antisocial behaviour. On the island, there is no evidence to determine which education category the children fall into, i.e. education at home or in school. Does the Health and Wellbeing Board agree the need for further action? The response is there is good actions in place with education being represented in the majority of child protection and child in need meetings. Links with education, local authority support such as education inclusion or electively home education or social care of good. If other agencies or support groups are aware of individuals not accessing education who are NEET, these should be reported to the authorities. So there's quite a lot of work going on there. I wonder what this board would add to that conversation. I don't think it's there, but you know, recognising that health colleagues will be part of the child protection system.
Debbie.
Just one committee that hasn't been mentioned is this has been picked up by the Isle of Wight Safeguarding Children's Partnership.
When Debbie comes in to talk, we can just mention that we've talked about this and make sure that they're fully connected in.
Okay,
That was a day to read.
thanks, Simon.
Yeah.
Yeah. No further public questions. Chairman's update. I'd love to give you an update. It's just, I'm not quite sure what it would contain. I'm sure you'll forgive me. Laura, I haven't had a chance to talk to Laura and get an idea of what an update might sound like. So apologies on this occasion. At the next meeting, I will bring you an update.
Update on the
Councillor
update.
Jordan, you can defer. I forgot to write that. Apologies.
Oh, Simon,
Simon used to write.
can't stand in the corner. Okay, integrated care partnership to receive an update. It's page 9 and 12 in our papers. Integrated care partnership, receive an update on the integrated care partnership strategic priorities. Simon.
Thanks very much, Councillor Jordan, and I welcome Ros Hartley online. She couldn't be here, and we've got Helen Conway from the ICB, so who've been working on the integrated care partnership. I thought I'd give a quick input to what the partnership's been doing and the priorities, that they can have a discussion. So there is an integrated care partnership for Isle of Wight ICB. And as the paper says, a lot of work's gone over the last 18 months to really design that partnership across the large geography, recognising the island is a unique but integral part of that board. So there's a joint committee which I co-chair as a Director of Public Health alongside Councillor Filker from Southampton, and it's a steering group for the partnership, really bringing parts together to think about key priorities for improving health of the population. There's two parts of the partnership. So there's one which is the committee and one which is the assembly, and there's been 3 assemblies for members across the whole of the ICP, recognising for the island when they're not close to the coast, it is more challenging. The last one was in Andover, but we've had good representation from island agencies and Pan Hampshire agencies. So paragraph 1.5, there was a really good assembly for mental well-being, and I did comment on that. It's the first time I've been on a board with about 80 people talking about mental well-being rather than mental ill health, because actually we often focus about mental ill health, not wrongly, but it was really good to have that. So the strategy has 5 key areas: children and young people, mental well-being, good health and proactive care, our people, and the digital solutions and data insights, all under a vision statement of healthier, safer, happier together, because actually it's about coming together to do that. And under those 3 priorities, the kind of strategic ones rather than enabling ones, there are a number of things in there, and you'll see how it's tying together nicely, because we are talking about the 1,001 days, which is an ICP priority, and we've talked about a number of the priorities here that relate to the ICP. That's by design, that everything is linked together. So for each of those priorities that you've in paragraph 2.5, there is an action plan, an aim where we're trying to get to, because we're not going to succeed in day one. So how do we do that? And a group that ties all that together working forward. The next integrated care partnership is on the 8th of November, and that will be really looking at anchor institutions and how we as anchor bodies, so the organisations that we work through, can really improve the health of the population. Ros or Helen, is there anything you want to add? Ros, can you?
Hi.
Ros,
Yes,
add?
sorry, yes, thank you very much. I think you've summed it up perfectly. I'm really, really happy to take questions. I think the key thing of the integrated care partnership is how we find those things that we can do better together that support the local place. So that's the key thing for me. Are there a few key things that Simon's outlined that we can do better collectively, and using the power of scale, but that can really support what happens locally on the island and in our other places? So I think I'm just going to pause there and then absolutely happy to take questions. Thank you very much for allowing me to dial in.
Thank you, Ross. Any questions, comments? Karen?
I was just looking at the other white on the last page, and it says invest in prevention and early intervention to help health and wellbeing. What does that look like?
So that's about our whole system approach, linking with the health and care plan, that actually we really want to think about prevention, knowing that if we can prevent ill health, that's much better than treating it and managing it, because actually we want people to remain well. That's what the aim of this board is, and that's how we're trying to find out.
Yeah, looked at that before, didn't we?
Thanks, Simon. Wendy?
I think I've got my grumpy head on this morning. I've got a bit of, well, I think I have a challenge for us, which is integrated care partnership strategy. It's been in place for a while now. We've discussed what it contains a lot. Health and wellbeing strategy, been in place for a while now. We've discussed what it contains a lot. Health and care partnership strategy, been in place a long time now. We've discussed what it contains a lot. Yet we're still asking ourselves the question, what can we do collectively better that makes a difference? Surely those strategies have actually evidenced for us what it is we can do together better to make a difference. And what we should be talking about is how we're actively doing that stuff and making a difference. And I would see that as being the question that the Health and Wellbeing Board wants to put and wants to hear back about. You know, the actual, so what is it we've identified? How are we doing it? And what difference do we think it's going to make, so that we know if it will make a difference or not?
Look at outcome.
Thanks,
Sorry.
Wendy.
Emma.
I'll come to you, Simon, if I may. Emma?
Thank you. I'm glad Wendy spoke first, because actually at the last meeting, we had a discussion about some of the practicalities of that, and it was around the suicide prevention elements. And I can see in the minutes that we all made a commitment to do the 20-minute training. I did it, my team did it, my family did it. Did anybody else do it? So there are those things that we can take away, even tiny little tasks that can make a difference.
So that's a really good example, and I think we've seen a graph because we can measure the number of people taking it with different postcodes, and we've seen a marked increase following all our comms around the island and around the RCB on the number of people taking that training. Wendy, I agree with you, and so I'll talk closely on the mental wellbeing one, which I've got more involvement in. We have said at system level, the thing we want to focus on is unemployment and volunteering, and how we really support that, because at local level we can do the work really well about mental wellbeing, community connection. But I think the ask for the ICB on that one is those two asks. How do we get volunteering better across our system? So how do we work in the NHS? How do we help people? I always proudly talk about our drug service that train people after they've been through the service to then become volunteers, and then they go out and get jobs. And yes, they've been through a rehab program, they're off drugs. But how do we do more of that at a system level, working with our mental health services, working with the maternity services, you know, people through health systems. So I think there's a lot we can do. And I think for me, Wendy, the ask from this board is system. That's what we need you to do so that we can get underneath that. But I recognise that there's other areas in there. And maybe the 1001 Days presentation today will help us give an ask up to the ICB, which I will take forward.
Thanks, Simon. Karen?
No, I was just agreeing with something. It's fine.
Yeah, just to add that one piece of evidence, I guess, is probably the work that Simon and I do in terms of co-chairing the Trauma Informed Board. All partners are signed up to that Trauma Informed Concord Act, so which is really, really good, getting in and training, you know, organisations around trauma and gripping ACEs and all that sort of stuff there. So and from the OPCC, just really, really welcome the opportunity that we've had to work with you know, the whole of the partners that are there, and the breadth of partners. It is really reassuring to see this isn't just a health-led thing. There's a whole wide variety of partners involved, and I think, you know, certainly every partner that I've spoken to have been able to say, do you know what, actually we feel that we really do have a place here, and the language that's being used and the priorities do link into our form of work. So great to have that as a real partnership.
Simon?
Terry, I agree. The trauma informed work has been fantastic. I think to date, it's been more focused on criminal justice partners not running it, and I don't think the health services really got it and understood. We know people who've experienced childhood trauma will have earlier cancer and more coronary heart disease. So how do we really help people understand that and to then change the interactions that we have? I recognise it's not easy, but I think we could do some work in the trust and with our colleagues to understand that better.
And of course, we've got Karen Dawes in our
Yeah.
office who's happy to work with, who's next round.
Emma.
For a informed bit, I wanted to give a shout out to the commissioners in housing because they've led a process around psychologically informed environment. So that absolutely brilliant forward working with every supported housing provider on the island up and now doing self-assessment. So if you're not aware of it, can we hold that in?
Together, yeah, that's great.
Thank you. Well, we can consider ourselves updated, Simon, can't we?
We'll take that action back to the IC.
Yeah, please do.
Next week. Yeah.
First 1,000 days.
Thank you, Helen.
Thank you, Ross. First 1,000
Colleagues,
days.
Rebecca Perrin and Ellen, sorry, I should include Sharon's going to help me with this board to make sure. So 1,001 days, as you've just heard, is an ICP priority. But we felt it's really important for this board to really think about the first 1,001 days, what we can do and what we can do together. And you're right, Councillor Lee put in a question really around whether it's going to start with that. Well, why in the presentation was there not an explicit mention of COVID? What we're saying is actually we need to think about all the issues affecting children and people, and COVID has been part of that thinking because we know that children have been affected by COVID, as we all have. So it is considered, but we're thinking about the building blocks for improving the health and the best start in life for everybody. I'll hand over to you, and you want me to present? I'll do my best. And if I've got any skills.
And welcome, and thank you for all your work that you do on our behalf, by the way.
Very much. Thanks for having us.
Get there.
So I'm Rebecca Perrin, I'm consultant in public health in the Simon team, and I lead on children, young people and families.
I'm Eleanor Reid, I'm the Service Manager for Public Health in the Isle of Wight, and one of my principal areas is children, young people, mothers too, but that's the focus today.
So today we'd like to talk to you about first 1,001 days, and the reason for that is
Can you hear? Are you struggling to hear?
earlier in the year we undertook a review of the first 1,001 days across Hampshire and the Isle of Wight, and this is the report that's come from that. So there will be a public facing report which will be published very soon on the website. So today just giving you a snapshot of that report. So the paper and then hopefully the slides. The reason for the review, the intention was to stimulate conversation between partners that work on the first 1,001 days, look at what the options might be for the direction that we want to go in, and some context for next steps taken at system and also at place. So why first 1,001 days? So when we talk about first 1,001 days, we mean pregnancy in the first 2 years of a child's life. And it's really clear from the evidence that this is a really significant and influential phase in a child's life, which also presents great opportunities, lays the foundation for the future of that child's health, well-being, learning, and ultimately their potential to contribute to society. So why is that? So firstly, their brains are developing, and that's mostly from the experiences that they have. They're forming relationships, and so for the majority of babies, they have a secure relationship with a sensitive and nurturing adult, which gives them a really strong foundation. But that isn't true for all children, and we know that that can have a significant impact. The other reason that first 1,001 days is really important is around the fact that change is possible. So it's easier to act early, and we know that families with the greatest need, if we do we focus on that early intervention, they can get the greatest gains from it, and it prevents us from needing to do more further down the line. So those are the reasons why we're focusing on the first 1,001 days. So what did we do in the review? So we had conversations with stakeholders, and that was across Hampshire and the Isle of Wight, but also wider than that, to look at what other areas we're doing. And that included voluntary sector, NHS, the health visiting service in particular, maternity services. So as I said, we also looked at what other local authorities are doing. We included the local maternity and neonatal system equity evaluation. That was really timely for us that they were conducting that, so that we could include parents' experiences of the support that they are given during pregnancy and postnatally. And then we obviously looked at our data as well, with the help of our intelligence team. So what did we find? So compared to England, we do have some positives. So some of our early years measures are compared favourably to the England average, but we do have some challenges. And particularly, we have some disparities within our geography. So whilst our average might be looking okay, we know that if you delve into that, there's another story to tell. So we know there's also room for improvement in terms of how we work together as partners. So there's some really good work, but we know that we can do better. And also front and centre of that is listening to our families. So some consistent themes emerged from our review, from parents, partners and the other local authority areas that we looked at. So firstly, around service design. So maintaining that balance between a universal service plus the targeted offer that we know that some families will need, and also including the value of the voluntary sector, and peer support came through really strongly. Another theme was infrastructure. So partnership links are good, but they could be better. Data sharing came up quite strongly as an opportunity to strengthen how we work together. And also having a shared culture, and the language that services use can be really confusing when we're using different language but meaning the same thing, as well as understanding each other's roles and responsibilities, and within our services the skill mix that might exist to best support families. And then a theme around parents and children, so really focusing in on the parent and carer and infant relationship, and the support that we can give to that relationship, making that as consistent as possible, and that we're all aligned to the importance of the first 1001 days. Next slide, please. So what we did with these themes is, rather than make recommendations in the review, we really looked at what strategies can we pull from this that will help us to work and deliver the best first 1001 days for children that we possibly can. So some of these strategies were, and they link through to the themes, so it might sound familiar to the things that I've just said, focusing on relationships, so that parent-carer and infant relationship, really investing in that through training for our staff, and offers such as the Solihull approach, which are our online parenting course offer. Again, focusing on the biggest issue, so whatever that family identifies as their biggest issue, ensuring that we can really focus on that, so enabling our staff to do that, and concentrating our resources in that area. The idea that it takes a village to raise a child, so that's not a new idea. I think we're all familiar with that, but really strengthening what that means in terms of how we can do that. Widening our network, so as I said, the value of the voluntary sector, and really creating those relationships between families and services before difficulties really bed in, so we can form that relationship and build the trust, and using the voice of the families throughout. So again, thinking about the tactics that we can use to address the challenges. So it's some of the things that came out of the review, including a gap in support immediately postnatally. So when parents transition out of the maternity service, where they've had a lot of support in those very early days, and then potentially not having as much support after that. So really thinking about how we can plug that postnatal gap. Making links between ourselves as partners stronger, not relying on individuals, but really thinking about how as organisations and services we can be stronger. Think about the training offer and how we can do that as partners as well across the different workforces. Thinking about our pathways between different services, and again involving parents and family in all of that. So in terms of some actions that other local authorities are taking that we might want to think about on the island. So agreeing what our shared goal is between ourselves, thinking about our different priorities as different agencies and how we can bring all of that together to have a shared goal. Making sure that we do bring along partners, including the fact that it's highlighted the importance of voluntary sector, and thinking about how our services are delivered. So co-location is something that's come out of the review, how we promote our services, how we embed our training and our shared principles as partners. And there's some real opportunities on the island. So some of the strengths that came out of the review, particularly around the island. So our Family Hubs programme is one of those. It's a really important opportunity for us to deliver on first 1,001 days, but also the really strong sense of community came through in the review. The fact that the workforce is slightly more stable on the island, so it doesn't have some of the issues that other local authorities have. The issues might be slightly different, but we have got a little bit more stability. And also the fact that we do have some really significant third sector partners, for example, Barnardo's already working in this first 1,001 days space. Some of the particular strengths that came out from the island. So this is just outlining the evidence-based approach that we already take in the first 1,001 days around the high impact areas. So there are 6 areas nationally. We have a 7th one locally around smoking and pregnancy, that we know if we do these things, we know that the evidence tells us that we can be effective in making first 1,001 days the best it can be. And so some principles, and this is the final slide, some principles that came from the review that we could, if at system level, if we focus in on these things, Simon was talking about earlier about, you know, the difference between what's the ask it system versus what can we do at place. So engaging with families to co-design the support that they would like to see in the first 1,001 days. Having a set of principles or an approach that works is something that we can also do at system level. Information sharing and really focusing in on that parent-infant attachment, focusing on relationships, recognising the extra value that voluntary and community sector brings, and joining up our training and our support for the workforce across the system with a long-term plan.
Thanks, Becca. I think almost back to Wendy's question, we had 2 slides there. This one about what can the system do, and we've had the first one, those 7 priorities. Are we all behind those, and how do we make sure? And I, you know, Joe, appreciate, I dropped your line, and we're going to sort out some of the maternity. There was an issue we couldn't quite get there. So I think there's an opportunity here for us to say, is that right? Where do we want to focus on as a Health and Wellbeing Board, and let's get behind it.
You did mention the Family Hubs and the Start the Life programme. So I have to confess I'm a little confused here, because obviously we commissioned Barnardo's. They are already delivering. In fact, we started on this in 2015 on the island. We were way ahead of the curve. So is this looking at a broader system approach as to how we bring this in? So because obviously we're at the point where we've opened and rebranded the first family hub. We've got 2 more family hubs with 6 boats, so we're going to have 9. The idea being it's a one-stop shop for families to come to for exactly that purpose. So from the moment of that they effectively find out that they're expecting right the way through those first 1001 days. So what are we adding? What's the added value to what's actually being delivered by Bernardo's?
In terms of what does the Family Hub programme bring that Bananas weren't already doing?
What are we trying to do here?
Trying to do.
We trying to do that is actually more than what is already happening, that we are commissioning through Bernardo's, through the family hubs, that is delivering the best start for life, a vision for the 1001 critical days government policy that was published in March 21.
So I think locally what we're trying to do is shine a light on it. So a few different partners, the ICP have identified first 1001 days as a priority. So this review, we feel kind of really bolsters that in terms of what's the evidence around it. A lot of it is all about what we're already doing, but what could we do even better? So I think particularly on the island, you've got that infrastructure already there, but there are still ways that we can enhance that offer. And obviously the Family Hubs programme is an opportunity with extra funding to really enhance the offer and build on what was already there.
Bit to me like we're
Well, from
almost
birth, Debbie.
Are we not, so for example, are we not outliers in smoking in pregnancy
Yes.
anymore?
We could do more in breastfeeding. Say, how do we add to all these programs?
that was my point. What's the added value?
Says, how do we add to all these programs? So actually, how do we even get better at breastfeeding so that the maternity service is really tied up, so that when Michelle sees a young mum in a clinic, actually the system is more signed up to those 7 priorities. Because yes, we've got commissioned services, but we all need, how do we work with the voluntary sector to say more? And Eleanor probably got the
Can I
detail.
just add in that I think from listening to what everyone's said, this might help. So if we imagine that the family hubs is something in addition for a short period of time to help bring everything together and give some direction for sort of changing things a bit, but it's in a landscape that already exists. So we already have the health visiting store nursing service, we already have maternity, we already have the early help service that Bernardo's is commissioned to do. Family hubs is additional money over and above to help us go that bit further and stretch out a bit more. And at the same time as that was happening, we were also planning this review, and it is fantastic news that it's all coming together and absolutely all makes sense. But the family hubs isn't really replacing what we've already got, it's enhancing, and we don't yet know, because we're going to wait to see what the evidence shows in terms of the evaluation of how effective it is, what will continue to happen, and there will be more policy that will come after that. But we do, as a local authority, have a statutory duty to deliver on the public health nursing element of it, which is very much embedded and within the family hubs. But it's there already, and it will continue. The family hubs money is an addition, and it's only for a short period of time. And it's there to help us come together much more strongly as partners, but it doesn't totally replace. So it doesn't also replace the maternity service, for example, which is there, always will be, but it is now becoming more integrated into it. So does that explain?
A little bit. It's just that obviously the idea of the family hub is that it's a one-stop shop. So
It's one way of delivering.
we're not feeding into that, are we? I think what I get from this is we're looking more at coordinating and providing a more cohesive offer that is broader than what the family hubs are offering.
One second. There's a number of people want to comment. Can I ask you to take this outside this and go direct to the public health team? I've got a number of people want to. So Wendy was first, and then Darren, and then Michelle, and then I'll come to you, Simon. Unless it's
fine. I can pick up the point to the end.
Okay, thank you.
I think what we're doing is we're looking at this at 2 different levels. So the first 1001 days, the piece of work, the review is looking at this at a much higher strategic level. And I think everything that's been mentioned here this morning is really valid. So there's an oversight and approach, and there's a delivery that's already happening. I think the question for us as the Health and Wellbeing Board is, how are we getting the best out of every pound we're spending in that delivery that is that is making the connections in the right way, that is providing an offer for our community that is useful, that is not duplicating another's roles, and that is making the best of everything we have. And that for me is the question. So, you know, we are commissioning Bernardo's. We do have the family help, the family hub work. We do the breastfeeding, and we do the smoking in pregnancy. How are we doing that in a way that our community is really clear about where they go for that help and the help that they get when they need it? And it might be a one-stop shop, it might be a different way, but for me, it's, again, it comes back to the doing and the impact it's having.
Thanks, Wendy. It sounded rhetorical. There wasn't a question in there, was
No,
it?
it was.
Darren.
Thank you. Similar theme to Wendy, actually. I think none of us could doubt or dispute what's been said, found in the review. At that ICP level, it's absolutely right, absolutely critically important. And that, therefore, is one of our strategic priorities. How then do we translate that into a delivery mechanism at a local level is our key task. And how many of the things that are highlighted in the review are already happening in one way, shape or form, to then focus our efforts on either enhancing those or putting those things in place that aren't already there. So I wonder whether through that conversation, there's almost like a gap analysis that we could start to do to really say 25 things, we're doing 16, they're great, got 9, that's right, maths. We've got 9 still to do. And work that through at a local level. And I think that's what we could add some significant value to this, if that's okay through you, Chair.
Thank you, Darren.
Is it all right to come back on that?
Michelle.
No, I didn't actually have anything to say. You thought I did, but I didn't.
Oh.
No, that's fine.
I was just,
I know. I don't.
she's just,
I was just prodding you.
Is it okay just to come back on that? Because I think that's
Of
the real
course.
beauty of the Family Hubs programme, in that it's an opportunity for us to particularly around the published offer. So that is part of the Family Hubs programme. And also just bringing everybody together as partners. So whilst we've been doing a lot of this work, what I've noticed about the Family Hubs programme is how it's bringing partners together, and the evaluation of it will show us, you know, whether that has added the value that we need, or whether there is still more work to be done. And no doubt there will be, because there always is. But once that the Family Hubs programme, you know, comes to its end in March 25. So I think that's where the island's in a really great position to have that Family Hubs programme to help us with that.
Darren.
Happily to support an evaluation process to review what we're currently doing, to consider how successful that's being. Mine's a wider point just about, are we doing some things that we can just carry on through an evaluation to ensure continuation, or are we needing to do more? And I don't know enough to be able to answer that question. I don't know whether the whole board knows enough to be able to answer that whole question. And that's the analysis that I was searching for. But it doesn't need to be particularly complex. Just give us a bit of a platform to do more. We're all striving for, aren't we?
Wendy.
So Darren's just picked up on the point that I was going to make. When programmes come to an end and you do an evaluation, that's one thing, because that leads you to where you need to go to next. But I think as a board, what we're saying is we've got the review, we've got the programmes that are operating already. How do those programmes fit some of the recommendations in the review? Are there any gaps? And more importantly, how do we get those programmes working together really effectively? And that's an ask of this board for a report back, not at the end of a programme, but to say the review's really good. It's given us really good information, but we want to take it to the next level, which is, okay, so how is that working now?
Thanks. Simon.
So I think that's really helpful. I think there's something about the Family Health Programme isn't necessarily just a health programme. So actually, let's really look at the health elements of that and make sure that as this board, we're really making the best of the health bits there's something also for me, it's not just about services. How many of our cafes in Newport are breastfeeding friendly? You know, that would be really, you know, so actually let's think really differently about this. And what can we do as a system to say that's what we want to do? So, you know, a conversation with Colin rather than a conversation with our health partners. Clearly picked up a little bit of a gap between what parents feel, I'm not saying it's true, when the maternity services stop and when the health services pick up. So how do we then look at that perception? What is it? And what do we do? Maybe it's a voluntary sector role in that or the system. So I think we picked up things. The reason to bring it here is say, this feels the right things to do. Are we agreed? And let's keep the work going rather than just moving forward. That.
Thank you, Simon. Any further comments?
I just had a comment.
Jill?
Really interesting discussion and talking as an old retired midwife. I think consistency of care is the most important thing. And what we've lost sometimes is that real bond between midwives moving on to paediatric care or whatever, and it's that consistency that people really, really want and that person that they can relate to. So do you think that the programme that you just talked through with us, will be getting that more, that people have, if you have your midwife or your health visitor or your volunteer even, whoever, do we get that consistency of care so that people feel that they had that backup, other than sometimes what does happen is you get this person with the best of intentions. If you haven't got that consistency, it makes it really difficult. So just wondering how we put that into the programme that we've been looking at, and do you think that's where we are at the moment?
I think that comes through in the kind of workforce elements of the review, in terms of the training, shared language. So it might not be that we can promise same member of staff, you know, following somebody through, but if in that work to bring us together more closely and more aligned as partners, that we try to get that consistency. And I'm probably repeating myself, but just it's a really important point. I feel that the work we're doing on family hubs is really bringing those partners together. So I think that gives us a platform to work on those things that are coming out of the review around consistency and a joint workforce, and how we can bring that together.
And a practical example of that is having pregnant women more involved in the family hubs whilst they're pregnant, and then meeting those same people who can support them whilst they've got small children. So they meet their health visitor at 18 weeks pregnant, they meet Bernardo staff when they're pregnant and being brought into the centres and seeing the places whilst they're pregnant. It feels familiar when they've got small children. So it's possibly going to work in that way more than maternity taking them through. It's more introducing the family people earlier on.
Emma?
It's just a suggestion, and I think you've actually met it. I think what I got from the report is the word relationship repeated over and over again, and actually just picking up on your point, Jill, that's about the relationship. It's not, consistency is a service provider's word for our knowledge, but the recipient has a relationship. And I think, Ellen, you've just described something about building a relationship. That was just a suggestion.
Wendy, I'll come to you after, of course.
Yeah, I think I just reflecting on what we do as a board and our responsibilities. So I guess that, you know, there are three questions I ask myself. Is this a priority for the island? Absolutely, it is. Have we got an understanding of what is being delivered? Yes, we have. Have we got an understanding of where there might be gaps and how we get effective delivery across the piece? That's the question. I think we're still, for me, that's the question I'm still not certain of. That's the follow-on piece of work for what we're discussing today.
We all sign up to that. We can do that piece of work. And that's why I wanted to bring it here to say, are we happy with this as an approach?
Yeah.
Steve?
Do you want to come back on that as well?
Yeah, it was partly on that, and it was the point that I wanted to make.
Yeah.
I think the board might be interested. So I sit on the Children's Trust, and so we're currently reviving the current plan in preparation for the next one, which will be 2025. And we've got three themes. One to do with education, one to do with sort of safeguarding, sort of safety and well-being, and then one to do with health, and got 3 strands within health one. So I chair it with Rachel, who's in the ICB, and we've got first 1,001 days. We've got children and young people's mental health, and we've got healthy weight in childhood. So it's just to let you know that that's an active way of also bringing together the partners. A tier, I guess, below this, but more than just separate services as well. So I just wanted to let you know that 1,001 days is running through that as well.
Yeah, and forgive me, it feels quite low level at a strategic board, but I think a few things we mentioned, I think it's probably important to gain some sort of reassurance around oracy and around, the conversations, communication skills that happen within this hub. I know that in education, for instance, there's a real issue with people getting to education, young people that have poor communication skills, lacking oracy. It sets them back, and then throughout their educational time, when we get to employers are now saying, 75% of them say they want the person and the communication skills over the qualification at times. Of course, we need the qualifications, but a big part of that. So I guess it's just about, in understanding or getting some reassurance that through the hub there are things like communication skills and oracy, speech and language taught throughout that. But again, it's very kind of low level for a strategic board, but it's there.
Yeah.
Right.
Any other comments, questions? Thank you for all the work on it. We appreciate all the work you do day in, day out. From numbers of years ago, the amount of work and effort that goes into some of this stuff. So thank you for that. So I'm just, you want to round this up? It's just.
We've had a good kind of, we understand what the baseline is. I think there's, as Wendy said, there's some work to do to really understand where the gaps are. I guess the ask is all partners, please do engage in that process so that we can bring that forward, and we'll bring back a report at a suitable moment in time, recognising, as always, there's that connection with the health and care partnership, which Michelle and I will connect on that and make sure the relevant bits come to the relevant bodies.
Thanks, Simon. The report was noted. Safeguarding Children's Partnership Annual Report 22-23. Debbie, are you going to present this? Thank you so much.
Debbie.
I'm here, thank you. Can everyone hear me okay?
Yeah.
Brilliant, thank you very much. Good morning, everybody. I'm Debbie Key. I'm the Strategic Partnership Manager representing Scott McKechnie, the Independent Chair and Scrutineer. Thank you for the invitation to share the Safeguarding Children Partnerships Yearly Report for 22-23, which is here for your consideration today. As you're aware, the publication of the yearly report is a statutory function of the partnership and is an overview of the effectiveness of the partnership arrangements, reflecting the responsibilities of all partners in fulfilling their safeguarding obligations. You will have read that the report is a detailed account of the work undertaken in 22-23 and highlights the commitment of services and organisations to safeguarding children. The yearly report, as you would expect, is a collaboration across our partnership. As with more recent yearly reports, we continue to see sustained higher levels of need, and this is combined with complexity of those needs. And the report clearly shows how partners continue to endeavour to respond to this. This means that the cycle of audit, scrutiny and assurance of the partnership continues to be in sharp focus alongside our learning and development offer. You'll see within the report that audits for this reporting period included vulnerable children missing education for medical reasons or illness, children referred to the multi-agency safeguarding hub for neglect, and thirdly, multi-agency practice using the unborn newborn baby safeguarding protocol. Education settings have continued with their self-assessment against safeguarding standards, and the self-assessment for all other relevant agencies and safeguarding partners has been moved permanently to Q1 of the financial year due to winter pressures experienced by agencies and services, in particular our health partners. And this took place as planned in Q1 of 23-24. The report considers the ongoing work streams of the Isle of Wight Safeguarding Children's Partnership arising from our strategic priorities in 22-23, the actions taken and the evaluation of the impact. In this reporting period, the Child Sexual Abuse Strategy and Toolkit were both launched, and the 2023-26 HIPS Child Exploitation and Extra Familial Harm Strategy was approved and published. Within the yearly report, the effectiveness of the Isle of Wight Learning and Development offer is also considered, and we respond to feedback from our multi-agency workforce, learning from audits, case reviews, our scrutiny work and our priorities. New for the 22-23 partnership arrangements has been the introduction of the scrutineer role. For the island, this has been combined with the independent chair role and has provided an additional layer of scrutiny and oversight for the partnership arrangements. Scott McKechnie became the independent chair and scrutineer in December 22 and has undertaken a scrutiny visit to MASH and observed some of our subgroups, considering effectiveness alongside other areas of work detailed within the yearly report for you. 2023 will see the new iteration of statutory guidance working together to safeguard children, and that has implications both strategically and operationally for partners. It's an exciting development paving the way forward for the reforms signalled in the government command paper, Stable Homes Built on Love. The DfE have noted the revised guidance is likely to be published in December 23. Locally, we've just finished our first Safeguarding Children's Week and are currently evaluating the effectiveness of working with partners to collectively share key safeguarding messages and resources, aiming to keep the work of the partnership in the line of sight of busy practitioners. The 22-23 yearly report concludes with the strategic priorities for 23-24. And the focus areas, as you can see, are child sexual abuse and embedding the HIPS child sexual abuse strategy and toolkit, vulnerable children and disrupted education, a focus on children missing school, those persistent or severely absent, the safeguarding risks arising from this, and the safeguarding risks that absence might arise from. We're also focusing on promoting and embedding the work of the partnership, developing a more systematic way to support agencies in embedding the resources of the partnership. We've started this already with a focus on the voluntary and community sector, with the development of a set of resources or a toolkit aimed at that particular sector. So in conclusion, and just to repeat briefly, all the work outlined in the report is the sum of the partners' collaborative efforts. And I hope you will agree the yearly report continues to reflect the mature and effective safeguarding partnership arrangements on the island. A safeguarding partnership focused on challenge, mutual support, on learning and improvement. And I'm happy to take any feedback or comments or questions, of course.
Thank you, Debbie. Any comments? Wendy? I'll come to you after.
Thank you. Thank you, Emma, for sending the report through. And I think, unsurprisingly, as Chief Exec of the Council, you would expect me to meet regularly with Scott to discuss any issues through the Safeguarding Partnership. One of the things that I found in my discussions is that partners do really actively play their role in the partnership, and Scott plays a very clear role as chair and provides real scrutiny and challenge to each of the partners in terms of really understanding the issues that are being brought to the partnership. From my perspective, I feel that gives me assurance for the Isle of Wight Council that we have a partnership in place which is working for the benefit of our children and young people. And I think that this is a really thorough report setting out their activity over the last year and what they've achieved and their programme of work for the future as well.
Thanks, Wendy. Emma, come to you after.
Thank you. I wanted to corroborate some of the comments around referrals through to MASH. So it was cited that there was a suspicion that Ofsted might be behind some of this increase, and I can confirm absolutely yes, they are from our perspective. So I'm aware of an early years setting in Hampshire that had a welfare requirements notice for not referring something that clearly did not meet threshold. And I do wonder whether there's a higher level strategic piece of work to be done with Ofsted, where Ofsted are now insisting on referrals for everything that we have a concern about, when we're very familiar with the thresholds and don't want to be wasting anybody's time, and also can provide a lot of safeguarding activity within our own services. So whether that's a conversation that perhaps could be taken a bit wider.
Debbie, thank you, Emma.
Yes, just to add really to what both Wendy and Emma have said, through my previous role as cabinet member for Children's Services and Education, I'm aware that we do get a high level of referrals anyway through our schools, because I know that this was a particular area of concern through COVID and the lockdowns when children weren't attending schools. I would just like to say about the report, I don't think look forward to is possibly the right expression, but up until recently, I've sat in as an observer on the Safeguarding Children's Partnership. I've always been very impressed with the reports that have come through, but I think the actual focus and the detail and the clarity of this year's report actually surpasses anything that I've seen before. It's not just a report for me that is presented. We look at it, we discuss it and move on. It's actually one of those documents that you can actually refer back to. And just thank you. I think it's a really excellent piece of work.
Thanks, Debbie.
Just to support colleagues, excellent. What do we do here as a board? Do we agree it, support it, note it?
It's for noting. We note it, Darren.
Perfect. Just want to make sure.
Hope you've read it from cover.
I have. It's very good.
Good. Well done. Fantastic.
Excellent report.
Any further comments, Simon?
Debbie, it's really helpful. A couple of comments for me. In the terms of the comms, how we continue to make sure that's based on the insight from the people we're trying to reach, and how we continue to do that. And then just to highlight, a risk is far too strong. We've got change of many health organisations and how we are recognising our health visiting services going to a much larger organisation that's going to be focused even more on mental health, and how we just make sure we don't lose that focus on children in that new organisation. It's a
good point.
Yeah. Thanks, Simon. And maybe not for this board, but I am aware that there is a weakness in the community safety partnership in terms of resources that the authority have managed to put in over years. I think elsewhere we need to address that, not for this board. I know you're all looking rather puzzled at why I mentioned that. I mention it because it is part of the issue and problem of safeguarding our children. That safety partnership, often the same people in this room are part of, but it's been brought to our attention, certainly in my attention, probably Wendy's too, that there is a weakness in that, and it's something as an authority I think we need to look at. It's outside this board. Thank you, Karen.
Just to clarify, it's not lack of resources, there's no funding for it. Just
No
a
funding.
bit different.
That sounds a lot.
But there's
sounds like
really been funding for it going for communities.
Thank you. The report's duly noted. That just brings us on to members' question time. I've got one written one. We referred to it earlier. It's from Councillor Michael Lilly. I'll read it out, but again, we've got a response, and it is: how has COVID-19 affected children born between 2019 and 22 on the Isle of Wight? And why was this not referenced in the report? The report being the 1001 days. There's an extensive reply from Simon. Unless you want to, I won't read it out. It will be published and given to Councillor Lilly in due course. So are we all happy with that? Okay, fine. Any other questions? All happy?
It's potentially a bit of AOB actually, Chair, if that's okay. And it's just a, if unless we're getting there, we get, is there an AOB on the agenda? Okay, just while we've got the board here, really, it's just to offer.
Call it a member's question.
A member's question, if that's okay, Chair. And it's just to offer, really, I know that I
can't make a question out.
Okay. Okay, so the question is, would it be beneficial to the board for me or somebody in the constabulary to update at some point, potentially at a future meeting as another item agenda on right care, right person and the forces response to mental health? I certainly brief your cabinet members on that, but they do change. So if, you know, certainly a briefing that we can prepare in terms of forces response to mental health demand.
We're changing the cabinet members.
haven't
Do you know
changed
something? I don't know.
Oh, no, but you've had the briefing though, haven't you?
It's still that.
Jenny, you've had the briefing, so.
So very good piece in the local government
Yeah.
magazine that I read.
If members feel it'd be useful, happy to present on what the
We've done a
forces.
quick around the board and we're all in agreement and we'll table that.
Very interesting, very interesting.
No further
I
questions.
just want to say at that point, I actually did the Observer with the police, the district team, and I watched that working for somebody that night went out. So I'll just give you that feedback. It worked well.
Okay, no further questions. We'll call the meeting to a close. Thank you all for attending. Our next meeting, I'm told, is 15th of January. So
Happy New Year.
Christmas and stuff. Well,
Christmas.
Am I the first to mention Christmas?
Happy Thanksgiving.
Probably.
Yeah. Thank you for all your help and support as always.
Nearly another year old.
Appreciate it.
I was thinking the January meeting might be good to really think about that JSNA piece, and do we do a closed meeting? So rather than have a public, we haven't discussed when to
Yeah,
that on the spot, but feels like that might be a place to have a, so rather than
Focus on something.
rather than a public